Late this spring, shocking headlines and viral photos. A wealthy Manhattan neighborhood seemingly overrun with an increase in homeless men and women. Residents sounding the alarm.
What we've really noticed is the increase in these sort of incidents. Open and illicit drug use, needles on the ground, things that I actually could not have ever imagined would have occurred just even a few weeks ago.
On the Upper West Side, 4 vacant tourist hotels were converted to temporary homeless shelters. More than 700 residents moving in, all part of a citywide effort to stop devastating coronavirus spread in a vulnerable population. During a virtual community board meeting, shelter leaders explained they had to move fast.
Normally, it takes about 2 years or more to create a shelter. We had about 2 weeks' notice for each hotel we opened.
That meant in some cases the facilities weren't ready or important details overlooked, like sex offenders with residency restrictions placed at the Belle Claire, around the corner from an elementary school. The shelter says they've since been moved out. Dr. Megan Martin started a group of concerned neighbors pushing to end the program, threatening to file a lawsuit if the city doesn't act.
The city was in an emergency situation. These shelters were incredibly dangerous. They had to act quickly. Why was this not an appropriate solution?
We've replaced one public health crisis with another. They've moved many of these individuals without the resources that they need.
But as the firestorm grew, those who support the shelters also took action, some suggesting that their neighbors were insensitive and even intolerant.
I have not seen any kind of danger or any kind of deterioration of quality life. And I walk past the Belle Claire every single morning.
College professor Melissa Sanchez organized neighborhood families to draw welcoming messages to residents, triggering this angry exchange with a grandmother passing by.
This is absurd, especially with their children. Are you surprised personally, someone who lives in this community, to see how angry people have gotten and how fraught this issue has been?
I'm really surprised. We know that people here are getting treatment. We also know that the strongest predictor for successful treatment is support of the community.
One in particular that said everyone needs a home. When I saw that really touched me.
But while anger flared on both sides, major crime rates actually fell. According to the NYPD, overall crime rates in the area are down over 5% from the same May through August time period last year. Under pressure, Mayor Bill de Blasio now says people will be moved back into established shelters as the health situation improves. But for some, it may be too late.
We do know many families who do not feel safe and who have put their apartments for sale,
contributing to a wave of people leaving New York City since the start of the pandemic. Opera singer Cheryl Warfield could be one of them.
So you're going to stay?
I may not. After 9/11, I was here at 9/11. My family expected me to move back home.
But you stayed.
But I stayed. But I may not be able to stay through this.
The Department of Homeless Services in this city says that this program has saved lives. And while there were missteps in the beginning, they have increased staff and services available. But Dr. Martin told us there is no level of staff and services that they would find suitable. They want a date for this program to end.